The Centers for Disease and Prevention say despite a significant decline in overall teen birth rates, there's still plenty of room for improvement. Joining me with more on the issue is Nanette Stam, Director of the Health Promotion Center at Vista Community Clinic. Welcome.
Thank you.
Now, Nanette, we have a graphic, and when we look at this graphic of teen births throughout the U.S., we see that since 1991, births among 17-year-olds have steadily declined from about 60,000 births each year to about 35,000 births in 2012. The decline is also seen in 15 and 16-year-olds. So why do you think there's fewer teens getting pregnant now?
Well, back in the early 90s, when we really saw the high teen pregnancy rates, a lot of programs were started to make that decline. And as you can see from the graph, year by year, we've been seeing the decline because there has been an emphasis on proactive ways to decrease teen pregnancy.
So a real focus on it, it sounds like. The CDC report found that birth rates for teens, age 15 to 17 are actually higher in Latino, Black, American, Indian, and Alaska Native teens. Why do you think that these particular population groups are at a higher risk?
Yeah, and actually those disparities aren't just in the 15 to 17-year-old range, it's throughout the teen years. And as we see with many health conditions, lower economic populations and minorities tend to have the disparities just because of living situations and lack of access to care.
Is it, do you see it where you work it as kind of a cultural issue as well? Are there certain cultures that, maybe it's not, either it's looked more favorably on or less favorably on? Is there something culturally going on as well?
Yeah, I think there are some cultural norms that play into it. It's also kind of a cyclical thing. So if there's been in a family teen pregnancies year after year or generation after generation, it seems kind of like a normal thing to do.
Another finding was that among sexually active teens, 90% used contraception, which was a bit of a surprise to me, but 80% said that they did not get any formal sexual education before their first sexual encounter. What grade does sex education start here in San Diego? And if the kids aren't getting their information from school, who are they getting it from?
Well, it really depends on the school district when they start and if they start sex education. There is California law that requires education on HIV prevention, but not on comprehensive sexuality. So it really depends school district by school district. And if they're not getting it at school, then they're getting it from their friends, from the social media sites. Ideally, they're getting it from the parents, but we know that parent-child communication tends to taper off in the teen years if people aren't proactive about it.
So is that kind of a challenge when you're dealing with teens as far as trying to educate them about the contraceptive options or sex education in general?
Yeah, believe it or not, they come in thinking they know it all, and we give them a pretest and find out they don't really know it all. And so we do educate them. But, it's really common to have misinformation, and things change in the field of science. So what used to be effective may not be as effective today. There may be something that's
When it
more
comes to birth control options available for teens, especially in these underserved and high-risk populations, what's out there for them, and how is that access right now?
Well, the whole range of birth control options are available. There's a California program called Family Pact that provides free and confidential reproductive health services to teens, so they can get everything. The one that's most recommended are what's called long-acting reversible contraception, so that's intrauterine devices or hormonal implants, so that teens don't have to worry about taking a pill every day or doing something right before every time they have sex.
Okay. And what kind of outreach does Vista Community Clinic do to try to reduce the pregnancy rates here in our area?
Well, since the mid-90s, we've taken a comprehensive approach to teen pregnancy. We realize, as the CDC does too, that it's more than one thing to bring the teen pregnancy rate down. So we provide health education in the schools, street outreach, just talking to teens on the street, comprehensive after-school programs for those that are at most risk for teen pregnancy, and then our teen clinic services where we offer a free and confidential environment for teens to access care.
And how well are those programs working? Are you able to track those?
Yeah, in our after-school program that we've been doing for over 15 years now, we've served over 3,000 youth, and these are specifically located in those hot spots I talked about. We've, in all those years, have only had 7 girls get pregnant while they've been involved, and 4 males say that they have impregnated someone. So that's a huge success rate for us, particularly when you look at who we're working with.
All right, well, we have a lot more information on our website, kpbs.org, including the report, so people can look at it themselves. Nanette Stam, thanks so much.
Thank you.